So when people think about robotic surgery, the word, they like always imagine a robot is doing the surgery, performing the OT table and all. Is it really the robot is performing the surgery, or it is still in doctor's control? What's the mechanism?
Very common question and very common perception. Okay, ever since robotic surgery came in, this question is being asked. And it's good that you asked me, because it's an opportunity for us to clarify
our viewers and all.
Exactly, to clarify to your viewers. Short answer: it is only the surgeon doing the operation. Okay, that's the short answer. The robot doesn't do the operation. That's the short answer. If I have to give you a long answer, I need to explain the system in a bit more detail. Would you like me to do that?
I will like to hear.
Right. Okay, so see, the robotic system can be divided into three. There are three parts, right? There's one part which is called the patient cart. The second part is called the surgeon console. And the third part is called the vision cart. So the patient cart, that's where the actual robotic arms are, right? So as I told you before, we need to make holes, just like how we make the holes for laparoscopic surgery. And through those holes, the surgeon introduces the robotic arms. So it is a surgeon doing it. I mean, the robot doesn't walk in and come and stand next to the patient and introduce all the arms
common imagery
and starts doing the operation. Absolutely not. The surgeon introduces the robotic arms into the patient, and once he's set everything up, the surgeon moves to the robotic console. And the robotic console is another equipment, part of the robotic system, which is usually about 10 feet away from the patient. And the main surgeon, the operating surgeon, goes to the robotic console, but the other surgeons, the assistant surgeons and the staff nurse and other assistants still remain next to the patient. So the operating surgeon who goes to the surgeon console does the operation from there. So he's got a monitor in which he looks at everything that's happening inside the abdomen. And he's got master controllers. He's got finger controls and foot pedals through which he does the operation. So basically the movements of the surgeon's fingers are translated to movements of the robotic instruments which have been placed inside the patient's abdominal cavity. Right? So every single movement that happens inside the patient is a result of what the surgeon does at the surgeon console. So there isn't any independent movement or independent thinking of the robotic arm whatsoever, right? And which is why I started off by saying it's a surgeon who's in charge. Surgeon is the one who's doing the operation. The entire process, the surgeon moving the fingers there and the pedals there, the robotic instruments moving inside the patient's abdominal cavity, the entire action can be viewed by the rest of the theatre team in the camera, which is in the vision cart. So that's the third part of the robotic system. Remember, I told you there's the patient cart, there's the surgeon console and the vision cart. And in the vision cart, there's a monitor there. Anyone who's in the operating room can watch what the surgeon is doing over there. And the vision cart also has other things which are essential for the operation, like the energy devices, we call them, and then the recording aspects and various other things, the insufflators and so on and so forth. So essentially, contrary to what many people may think, it is not a human form robo walking into theatre, standing next to the patient and putting the holes and doing the operation. It is the surgeon who is trained to operate this robotic system. The surgeon uses the system as a tool to perform the operation in a meticulous way, in a precise way, and by looking at the structures in a more magnified way. And that gives better outcome. There's no doubt about that.
যদি কারোর মনে এই ছবিটা থেকে থাকে রোবোটিক সার্জারি মানে একটা রোবট হেঁটে হেঁটে এলো দেন সার্জারি টেবিলে শুরু করলো কাজ, এমনটা একেবারেই নয় যেটা ডাক্তারবাবু বুঝিয়ে বললেন। সার্জন ডাক্তারবাবু তিনিই পুরো কন্ট্রোলটা করেন, বাট দ্য মেশিনারি সিস্টেম, দ্য টোটাল যে মেশিন, সেই পুরো ব্যাপারটাকে বলা হচ্ছে রোবোটিক সার্জারি।